It's now my pleasure to pass the mic to Christina Dolkovitz, who's not far from where I am in Ottawa. She's based out of the Lanark Renfrew Health and Community Services, and she's going to be talking about the lung health program. So over to you, Christina.
Thanks, Neil. Hi, everyone. Good morning and good afternoon. As Neil said, my name is Christina. I'm a respiratory therapist, and I'm the coordinator of the lung health program out here at Lanark Renfrew Health and Community Services, which is about an hour west of Ottawa in rural Eastern Ontario. Next slide. So our Party Health Challenge was focused on people living with COPD and to help keep them safe at home. So COPD stands for chronic obstructive pulmonary disease, mostly caused by smoking, although there are other environmental factors that can cause this. People with COPD can experience shortness of breath, a cough, maybe some sputum. It is a progressive disease, so unfortunately, once it's there, we can't reverse it. And so it does worsen over time. It can cause decreased physical activity, isolation, a lower quality of life, and people living with COPD tend to often experience high ED visits and hospitalizations. So what we proposed back in May when we signed up for the challenge was that we would focus with early screening and identification of people at risk, because the earlier we could identify, we could provide interventions, and also a 1-800 phone number for people with COPD to call if they're feeling unwell. A respiratory therapist would call them back and help them stay out of the emergency department. Next slide. So the biggest, I think, achievement for us was the fact that we engaged with patients. We had 3 amazing women who participated in our program, all living with COPD, who helped really drive the challenge forward in a way that maybe we didn't think of driving it forward. And that a big one was, how are we going to let people know about the emergency phone line? So with the patient's feedback, we now have a quarterly newsletter that's sent out via electronically, and also a Facebook page for our program, because unless the client was right in front of us, they would never know of all these quality improvement initiatives that we were doing, as well as the emergency phone line. You can see it in the top right-hand corner. So we printed off about 1,000 magnets thanks to some funding from CFHI from the Health Challenge, and was able to embed it right into the COPD action plan that we would print off and give to clients. Next slide, Neil. And of course, then COVID hit, which was a big challenge because we had big plans for the health, for the Party Health Challenge. Made us do a complete flip, as everyone else on this phone call can appreciate. But I think when life gives you lemons, make lemonade, because the COVID forced us to shift direction to how are we going to offer our rehab program virtually, because obviously with restrictions in place, nobody could come on site now to participate in our rehabilitation program. And so in keeping with our challenge focus of helping people with COPD stay safe at home, is we've partnered with the University of Ottawa Heart Institute. They have an existing cardiac rehabilitation on their virtual care platform. And we're taking this existing platform that's been in place since 2016 and building our pulmonary components into it. And for those in our rural area, we experience a lot of clients who don't have access to internet. So we have purchased tablets, and we'll preload our program onto the tablets to loan out to clients, and which has caused a new development of our rehab flow and how we were going to measure this. I think the nice thing about this is the lemonade and the whole thing is that with the virtual platform and the tablets, now we can actually reach a much larger population than we were before, because before they had to be close to the rehab sites and they had to be able to get transportation to the rehab sites, and it had to fit within those 2 days that we were only on site to offer the program, where now it's like patients have the option of participating in which rehab program best fits for them. So I really feel our reach is going to be much larger because of this. Next slide, Neil. So next steps for us is, we had chatted before COVID hit, we were partnering with CFHI to help me host a town hall in one of our small rural towns to partner with our patients, caregivers, and our community partners to really identify, okay, what are we missing here? How can we help support clients more in our community? And unfortunately, that was put on hold because of COVID, but I'm really hoping at some point we can take it off hold and move forward with that again. To continue with different avenues of reaching out to residents to let them know the services we offer and monitor the use of the emergency phone line. We didn't get the uptake that we thought we were going to get, and through the town hall, I'm hoping to figure out if that's really the best thing that we need to be offering clients, and if not, what else can we do to help them keep out of the emergency department.